Tinnitus in children. Even though many children have experienced tinnitus, particularly children with hearing loss, children are less likely to report tinnitus than adults. Parents are often unaware their child could even develop tinnitus. It is critical that children are asked and learn about tinnitus. Limitations in a child's language and communication abilities may make it difficult for them to describe it. Children can sometimes describe tinnitus in similar terms to adults, that is, ringing, buzzing, or chirping. However, they can also use creative or emotive descriptors, such as sounds like car beeping or angry bees buzzing. Sometimes children like to draw their tinnitus to help them explain it. In hearing clinics, clinicians should routinely ask about tinnitus and offer tinnitus care in child and family-friendly settings. Clinicians should also be aware of soft signs of tinnitus, such as unexplained listening behaviors, speech perception difficulties, concentration difficulties, worry or anxiety, or difficulties completing hearing tests. Tinnitus can interfere with sleep and concentration at school. Risk factors for tinnitus are female gender, history of ear infection or sinusitis, leisure noise exposure, gaming, alcohol consumption, and cigarette smoking. A large study in Nigeria showed that the main causes of tinnitus in their childhood population were identified as febrile illnesses, otitis media, noise exposure, impacted earwax, ototoxicity, or of unknown cause. Older age is associated with tinnitus, with teenagers experiencing it more than younger children. Adolescents with tinnitus were also found to suffer more physical and mental health problems than those without tinnitus. Guidance strongly recommends that clinicians are alert to behavioral and psychological well-being of all children with tinnitus and understand it may be linked to symptoms of depression. The recently developed Impact of Tinnitus in Children questionnaire has been used for 8 to 16-year-olds to assess problems that are most commonly aligned to children's experience of tinnitus. Severe tinnitus in children can be associated with pathologies of middle and inner ear structures, including vestibular schwannomas, cholesteatomas, trauma, Chiari malformations, and labyrinthitis ossificans. Tinnitus assessment should involve history taking and questions about emotional health, hearing and listening, how it affects taking part in activities, and whether it affects relationships. It may help for children to think about their tinnitus over the past 2 weeks, which ear it affects, and rate their experience from no symptoms to persistent symptoms. Questions can include whether their tinnitus has prevented sleep, concentration, reading, relaxation, listening, understanding people speaking on TV, or understanding people speaking in person. Also, whether tinnitus affects tiredness, learning, and emotional health, including sadness, anxiety, feeling confused or angry. Although there is no cure for tinnitus, tinnitus management focuses on addressing underlying causes like earwax or medications, using sound therapy, health apps, and hearing aids to mask or distract from the sounds. Psychological therapies like cognitive behavioral therapy, known as CBT, to manage the distress and anxiety associated with tinnitus. Lifestyle changes such as avoiding loud noises and practicing relaxation can also help. Some people find falling asleep to music or white noise, such as the continuous low rumble of a fan, helpful. Further information about prevention of tinnitus from loud noise is available from the Make Listening Safe section of the World Hearing Forum website, which is hosted by the World Health Organization. The Tinnitus UK website or ENT UK website provide further free information about management and research.